physical therapy can help with knee arthritis. And knee arthritis is something we deal with pretty much every single day to some degree. Most folks have some sort of knee issue coming along the line, and whether it affects them or not, it does alter their plan of care and their treatment that we kind of have to work around. And a lot of people will say that because they're knee arthritis, they're never going to get better. And I couldn't find something that is further from the truth. In fact, knee arthritis is something that's super, super manageable from a PT standpoint. And a lot of people do very, very well with kind of conservative management, whether that's kind of inflammatory control in combination with physical therapy and kind of soft tissue techniques to get them back to most everything they're used to doing. Now, there is a certain point where maybe that arthritis gets to a point, maybe you're genetically blessed to have maybe more aggressive form of arthritis that warrants possible surgical interventions. But I would say the vast majority of folks don't need surgery. And so today, in physical therapy, what we tend to do, and there's kind of a threefold process. And the first one, let me actually write this down maybe, would be, see if we can get some of the stuff here. We want to manage the inflammation. Because a lot of times arthritis is an irritable diagnosis, and a lot of times it's usually because of overuse. The joint in the area affected has some inflammation. And in physical therapy, we can do that a variety of different ways. First of all, we want to get the soft tissue moving. That's going to promote circulation. It's going to promote new nutrients in, waste products out. And with that comes healing agents to kind of promote any sort of tissue irritation, but also getting rid of any some of that inflammatory component there to help reduce pain, because that in and of itself can be a trigger for pain. For us, we have cupping, which we talked about a couple times ago. You got the silicone cups here that we can use, or we got these guys here. That also helps with tissue mobility and circulation. And as we talked last time, that kind of novel input can help reduce pain just in general because it's a new stimulus. We can use soft tissue tools, what we call Graston technique, or Iastm, instrument-assisted soft tissue mobility tool. And again, that's going to promote tissue mobility. A lot of times with these chronic irritable joints, we've had this low-grade inflammation, and early on, that inflammation starts off as kind of a watery type substance, but then it progresses to more of a toothpaste type consistency and starts kind of gluing layers of tissue together where they don't slide as easily. That's perfect for that tool to kind of break up that adhesive kind of stuff, get more circulation moving through so that the joint can move better and we have less pain while we're moving it. The next step after we kind of get that inflammation going, and I should say that while we're on that topic, kinesio taping is actually a really good way to manage some inflammation as well. That helps not only stabilize the joint a little bit, but it also helps lift up the skin, promote lymph flow, and decrease pain and irritation that way. The next one is we want to load the joint, okay? And a lot of times people say, well, I have arthritis. I don't want to strengthen it because it's going to aggravate it. And that couldn't be further from the truth. In fact, we have a saying, motion is lotion. With arthritis, you're going to respond better to things that move. And the more you move it, the better it's going to feel, not only from a circulation standpoint, but that joint's not going to get as stiff. Usually with arthritic conditions, that the more you avoid moving that joint, the stiffer it's going to be and the more painful it's going to be when you do decide to move it. So if you can keep it regularly moving, long-term, we see a lot better outcomes with that. And then lastly, we can talk about different ways to manage the joint as far as long-term solutions. And a lot of times that can be with, a continuum of exercise. And that might not be in physical therapy itself. That might be something we teach you to do out of the box down the line. Maybe you're working with a personal trainer, maybe you're doing it in the gym. But really what we find that most folks do very well with is staying active, as we kind of alluded to earlier. So throughout this week, we're going to be talking kind of different management tools of the arthritic knee and kind of how to go down that road. But if you do have questions in the meantime, hit us up, message us, give us a call. And we do have those discovery visits as we've talked to. If you're interested, definitely check it out. And if not, we'll catch you on the next one. Have a great day, you guys.